This is AbdominalHysterectomy.org, and this video is going to be about hysterectomy side effects and what you should be expecting. So, first we need to understand what are hysterectomies and why are they done. So there's about 500,000 hysterectomies performed in the US every year, which is a fair amount. And at this point, it is thought that could be a large percentage of those are performed unnecessarily. So there are different types of hysterectomies. There's supracervical, total, radical, abdominal, vaginal, laparoscopic, and so on. And each one is going to have its own particular side effects in terms of recovery, and then as a group, they will have a common set of side effects. So, what are the causes? There's a couple major causes. One is uterine fibroids, cervical cancer, benign tumors, endometriosis, prolapsing. Those are going to be your major causes for hysterectomy. There are rarer causes, including sort of an uncontrollable menses, but that's hysterectomies are used in that case as pretty much a last resort. So after hysterectomy, you're going to be having normal post-operative recovery. So that's going to vary depending on what kind of hysterectomy you have, whether it's transvaginal or abdominal, if it's laparoscopic or not. Typically, the shortest recovery is going to be from a laparoscopic transvaginal procedure, whereas the longest recovery time will be through an abdominal hysterectomy. But that is all going to vary from person to person. There often are sexual side effects as far as discomfort. There could be prolonged periods, heavy bleeding, abdominal pain. You're most likely going to be, if you're not already in menopause, you're going to go through the menopause, through the removal of the uterus and possibly the ovaries, and that brings with it a whole host of hormonal changes, which can affect different people differently. Some people gain weight, some people lose weight, some people find themselves moodier, some people find themselves more even-keeled. So it's going to be a highly individual long-term side effect or set of side effects. Final thoughts. Cancer is an ugly beast. Giving up being able to have children is a huge decision, and often the help of and support of many people is needed. So if there are options other than surgery, other than a hysterectomy, you definitely want to make sure you explore those, but in many cases, it is what is necessary in order to preserve your life and quality of life. So with those thoughts, know what you're getting into. And to find out more, check out our site, AbdominalHysterectomy.org. You'll find the link below the video.